Hello everyone, this is Mr. Elil, Assistant Professor, Department of Pharmacognosy, Sri Shanmuga College of Pharmacy. So today we are going to cover a very important foundational topic in pharmacognosy. So classification of crude drugs. Okay. So first of all, what are crude drugs? Okay. So crude drugs means any natural substances which is derived from the plant, animal, or mineral that is used in its raw or minimally processed form is known as a crude drug. Okay, the key point here is no significant chemical processing is undergone, so they may be dried, sized, or simply cleaned, but their chemical nature is not altered. So that is what the crude drug is. So these drugs contain active constituents that are responsible for the therapeutic effect. Okay, for example, a bark of cinchona. So it contains quinine. Quinine is one of the anti-malarial drugs, so first covered anti-malarial drug. So the leaf of digitalis, it contains cardioglycosides, and also the root of revolvia contains aspirin. So these are all the crude drugs, the plant part used as it is. So you will also hear them called galancials or natural drugs. Okay, so they form the very foundation of the modern pharmacognosy. So some quick examples to be remembered are plant origin or digital leaves, cinchona barks, and the ginger root. So animal derived crude drugs are cod liver oil, beeswax, and musk. So then mineral derived aromas, kaolin, talc, sulfur. So next is about the types of crude drugs. So before we classify them, let us understand the five types of crude drugs based on their origin. Okay, so first is about the plant origin. Okay, this is the largest group. About 80% of all crude drugs are come from the plant sources. For example, from the different plant parts called roots, barks, leaves, seeds, fruits. So examples are opium, senna, gingers, and digitalis, and etc. So second is about the animal origin or animal derived crude drugs. These comes from the animal tissues, secretions, or organs. So examples for the animal origins are cod liver oil, beeswax, and musk gelatin. And third is about the mineral origin. So these are inorganic earth substances, kaolin for diarrhea, and talc is a dusting powder, and sulfur for I think skin conditions. Okay, so then fourth is about the microbial origin. It is derived from the fungi or bacteria. For example, ergot, it is one of the crude drug. It is comes from the fungus and the penicillin and the streptomycin. I mean, ergot come from the fungus and also penicillin. You all know it is one of the important antibiotic. Penicillin and streptomycin are come from the bacteria. Okay, so then fifth is about the marine sources. Uh, Marine sources, it is a derivative from the sea organisms. Examples for the marine organisms are agar, shark liver oil, and carrageenan. So just remember, plant origin drugs are the majority, and pharmacognosy is primarily concerned with the uh, plant derived organisms. So next is about the classification of crude drug. So why do we classify? Okay, now why classification is important? There are three reasons. So first is to systematically organize a large number of crude drugs, then to facilitate the study, identification, and retrieval. Then third is to understand the relationship between the different crude drugs. Okay, so and there are seven major system of classification. So let us go through each one now. So first is about the alphabetical classification. Okay, this is the simplest system of classification. So the crude drugs are arranged from the alphabetical order, like A to Z, by their Latin or common name. For example, acacia, conate, aloe, under A, and under B is belladonna, benzoin, under C is clove, cinchona. So where is it used means in pharmacopoeias like the British pharmacopoeia, the Indian pharmacopoeia. So drugs are listed alphabetically for a easy reference. Okay, so then the advantages of this classification is anyone can use it, and also no special scientific knowledgeable person is needed, and also easy retrieval. Then the demerits are it has absolutely no scientific basis. Okay, digitalis and daughter are both under D, but they are completely unrelated in their chemistry and also their therapeutic action. It tells you nothing about what the drug does and also what it contains. Okay, it is useful for only for the reference, not for the understanding. So next is about the morphological classification. Okay, so here the crude drugs are classified based on the parts of the plants used. Okay, for example, roots, uh, the crude drug derivative from the roots are example for the roots are aconite, licorice, revolvia. So simply we can say it is classified based on the parts of the plant. Then advantages of this morphological classifications are it is very practical. When you receive a crude drug sample, you can immediately identify what plant part it is, very useful in the quality control and crude drug identification. Okay, then the demerits are it groups drugs by physical form, so not by what they do or what they contain. Okay, so two different leaves may completely different actions, so again practical but limited. So next is about the taxonomical classification or botanical classification. This system classifies crude drugs based on their plant family, means a natural order, like by their order, class, suborder. So these kind of natural orders are used. Okay, so natural order in botany are used to classify the crude drugs. For example, Solanaceae family. So what are all the crude drugs are comes under Solanaceae family are listed out in the Solanaceae family. So here is the key principle. The plants of the same family often share some similar chemical constituents. That is why belladonna, retro, and iosomas, all Solanaceae all contain atropine and iosine. Okay. So advantages of this taxonomical classification is it helps us find a drug substitutes. It reveals a botanical relationship also. And disadvantages are it requires some deep knowledge of the botany and the complex nomenclatures. So it is not directly useful in the clinical practice. Okay. So next is about the chemical classification. So now we are a little bit getting into the science. Okay, the system classifies the drugs based on their active chemical constituents. Okay, the classification directly explains the pharmacological action. If you know a drug contain an alkaloid, you already have a good idea of how it might behave. Okay, it is especially useful in the phytochemistry research and drug standardization. Some So we can easily say the chemical classification is classified based on the secondary metabolites present in the uh, specific crude drugs. Okay, so some disadvantages are a single crude drug can contain multiple chemical constituents. So that time it is very difficult to classify them under the particular secondary metabolites. Okay, so where do you put it means classification becomes complicated when a drug has a multiple active principle. Okay, so next is about the pharmacological classification. So this is the most clinically useful and the most preferred classification in modern pharmacognosy. So drugs are based on their therapeutic or pharmacological action. For example, cardiotonics, antihypertensive drugs, laxatives. If means antihypertensives, crude drugs are classified under these actions. So if drugs are if 10 crude drugs are having a cardiotonic effect, these 10 crude drugs are classified under the cardiotonics groups. Okay, so uh, these are most clinically useful classification and also directly linked to the therapeutic action and easy to apply in practice and preferred by the medical professional. This is what doctors, pharmacists, and students find most relevant. When a patient has a malaria, you want to know which drug treats malaria, not which plant family it belongs to. Okay, so some disadvantages are a single drug may have multiple pharmacological actions, as we saw in the mm, as we saw in the therapeutic classifications. So a single drug may have a multiple pharmacological actions. For example, leucorrhea is an expectorant and anti-inflammatory and also a laxative. Okay, so you can't classify under one therapeutic action, so it is very difficult. So squil is both a cardiotonic and expectorant. So overlap between the categories is a real problem here. But still, pharmacological combined with the chemical classification is the golden standard in the modern pharmacognosy. Next is about the biogenetical classification. It is crude drugs are classified based on the biogenetic pathways of the active constituents. This is the most advanced system. Drugs are grouped based on the biosynthetic pathways. It means how the plant makes the active constituents inside its own cells. Okay, there are four major pathways: the state pathways produced fixed oils and fatty acids and terpenes. For examples are linseed, castor oil, and clove oil. And also the Shikimate pathway produces tannins and lignins, and the Mavelanate pathway produces steroids, terpenes, and saponins, and amino acid pathway produces alkalides. So this is how crude drugs are classified by their biosynthetic pathways. So advantages are it links the chemistry to the evolution invaluable in the drug discovery research and shows the chemical evolution of the plant and useful in the research and drug discovery. And the disadvantages are extremely it is very extremely complex and not practical for everyday clinical use, mainly used in the research settings. Okay, so next is about the chemotaxonomy classification, and also this final system combines the chemistry and taxonomy, and plants are grouped based on these shared chemical markers that also reflect their evolutionary relationship. So tropane alkalides are found across the Solanaceae family. So for examples are belladonna, datra, ISMS, and anthraquinones are shared by the senna, aloe, and cascara. Okay, then the system is especially useful in the evolutionary studies and in predicting which plants might yield new drugs. Okay, so let's come to the summary. So let me bring everything together now. So we have a seven classification system, and each serves as a different purposes, like alphabetical best for reference and indexing, and morphological is for identification and quantity control, and taxonomical is for botanical studies, and chemical classification is for phytochemistry research, and pharmacological classification is for clinical and therapeutic practice. Biogenetical is for research and drug discovery, and the chemotaxonomical for evolutionary studies. Okay, so the most important point I want you to remember is no single classification system is perfect. Okay, so every system has its own limitations. So a drug may contain multiple chemical groups, have a multiple pharmacological action, and belongs to a complex plant family all at once. So that is why in modern pharmacognosy we combine systems, okay, particularly pharmacological and chemical, to get a most complete picture. Okay, so this is a summary table of classification at a glance. So please review all the seven system before our next session, and make sure you can give the at least two example for each one. So thank you very much for your attention, and thank you.